This is Going Under, Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh. We're brought to you by the Butterfly Network.
As always.
As always.
All right, I'm going to let you in on something that's completely changed the way I practice. I've been using butterfly probes for years. It's a portable ultrasound that plugs right into my compatible smartphone or tablet, so I can start scanning it in the bedside in seconds. If you've used older versions, or even if you're new to the handheld ultrasound game, let me tell you why this new IQ3 is a game changer and really impressive. First off, having an ultrasound that literally fits in my pocket means that I can move more quickly, whether it's vascular access, procedural guidance, or just getting real-time insights from my patients. And the tech inside this tiny device is pretty incredible. Biplane imaging lets me see short and long axis simultaneously, huge for procedural guidance, and honestly, a great tool for learners. The new needle out of plane preset even shifts the scan plane digitally, so I can see the needle tip sooner, which makes a real difference when precision matters. And the image quality, honestly, the IQ3 holds up against some of the high-end cart systems I've used. That's impressive for something this portable. If you're looking for a device that supports your practice, I can't recommend the Butterfly IQ3 enough. And right now, they're running a special offer. You can get $750 off the latest IQ3. Check it out at butterflynetwork.com.
We have a very special guest today. Mr. Dave Schrock is joining us here. And I know you know him through church influence.
Yes,
and he also has a remarkable story.
Many of them, in fact. I'm learning more and more. Even today, I'm learning more and more of them. So,
Dave, thanks for being on the podcast.
Well, thanks for having me. It's an honor.
Absolutely, absolutely. So, I have to start out with just share with us how we know each other, and then maybe a little bit about your faith and how you got, kind of where you are there, and then we'll talk deeper on more things.
Yeah. So met Brian at Influence. A church here in Granger, Indiana. Who's this handsome guy with this beautiful young lady? And then I met your co-partner, and Bronson.
Yep.
And found out you guys were in cahoots with each other. So got to talking and chatting, and pretty soon figured out who each other are, and so that's how we met.
Yeah.
That's a good word, cahoots.
Cahoots.
They are often in cahoots with each other.
Probably an old term, right?
No, but it's a true term. So tell us a little bit about. Let's talk a little bit about heart health first.
We can talk a little bit.
Yeah.
We'll talk a little bit about heart health. And Dave, you'll obviously share with us later. It's even though it is Breast Cancer Awareness Month, we're always talking about heart health. So. Obviously, heart disease and heart failure are a couple of the most common things that cause both morbidity and mortality in the United States. And so before we get into that, I want to talk about the farming end of things. But so we're going to talk a little bit. Dave's got a really cool story about his heart, his physical heart, as well as his spiritual heart, but his physical heart and what he went through with that. But Dave also runs multiple thousands of acres of farms. And so tell us a little bit about that, how you got into that. And then tell us a little bit, I know we were talking off air, but tell us a little bit about all the things that are going on in farming that's different than when you started, decades ago.
So if I get long-winded, just have to give it a look. So, but I was raised on a farm, livestock and grain farm in Elkhart County, Indiana. And I'm the oldest of four boys. And I'm really the only one that turned out to be a farmer. Okay. I always enjoyed the farm, even the dirty tasks and the things that people didn't want to do. I always enjoyed them because I loved animal husbandry and I loved growing crops. So I ended up being the farmer in the family. But I started farming on my own. Actually, in 1973, my dad said, "You want to grow some corn on your own?" So I rented a little bit of land from a family friend and for my first corn crop in that spring of 73. So
how many acres was that?
80 acres.
Okay.
So,
that's a little. That's a little farm.
That's a little farm.
Yeah.
So
compared to
back then, in the 70s, if you could rent an 80, that was pretty good. That was worth farming. So, but fast forward to the late 70s, early 80s, the farm crisis. I had realized we'd just gotten married in 1978, and I realized this was not going to be a way to make a living. Interest rates had risen to 20%, and we were borrowing all the money that we used.
Right.
And so I decided to get into construction work, and started an excavating company on my own in 1986. But my love was always on the farm. It's just what I really wanted to do. And so that entire time, my wife and I had invested in some land. So we had farmland, and I watched every spring, and I would go out there and, help. And, always was sharecropping. I was a landlord and had someone else farming it. So I've had a corn crop every year since 1973.
Wow.
So, but then, at age 40, would have been 1996. By that time, I had a large construction company, and they had a big surprise party for me. And at my 40th birthday party, I announced that I was starting back up farming.
Nice.
And everyone laughed because I myself thought it was just going to be a hobby farm. I was going to farm 500 acres, maybe 700 acres. And that quickly grew. Fast forward to about 10 years ago, we would have reached our max of about 11,000 acres.
Wow.
So, yeah,
11,000
so I really
acres.
grew that. I just love farming. I just love to watch crops grow, and I still love animals, but with my compromised immune system from a heart transplant that we're going to talk about a little bit later, livestock is not really a good thing for me to be around. So
Yeah. And you were saying, it's a lot different now and a lot of things I didn't even know, but a lot different now than it was in 1973. All the analytics and stuff. So can you share a little bit about how was that transition from, the 70s, the 80s, the 90s, and then now all the stuff that you can.
Yeah. So if you look at commodity prices, commodity prices are extra low right now, but corn should be $12, $14 a bushel if you did inflation, if you follow the GDP or whatever. And, we're sub $4 corn. So what's happened is we've had to become more efficient. We've just had to really shave every corner. We've had to use bigger equipment, less labor. And so this is all data driven. So in the late 90s, we started seeing what's a yield monitor. We did this thing in the combine that would estimate, what we were producing at any given acre. It's all georeferenced and everything. So it's just progressed. It's gotten more and more precise. We are analyzing soil tests on 1 acre grids, but we're farming these farms on 60-foot squares.
It's crazy.
So, yeah, it's crazy. So, we can populate different populations. We can, this is all done. We write prescriptions on the computer, put them on a thumb drive. They go into the, and it's all cloud-based too. So, you put the thumb drive in there just to make sure that, because you can lose cloud, for any reason.
Not with Starlink though, right?
Yeah.
So you were saying that the amount of data you generate from the fellow in Kentucky is like more than.
Yeah. So the guy that wrote our software is called YMS that we use. He shared with us that he'd wrote the software for Caterpillar Parts Network, and Caterpillar worldwide
international
actually has less data points than most of our farms.
Each individual
that's
farm.
Crazy. Each individual farm. So
it's
crazy to think. And I mean, it'd be interesting to have, a computer set up sometime and show people on a video, but we're collecting weather data, we're collecting elevation, we're collecting
everything,
grain moisture. It's insane the amount of data that we're bringing into this little computer box, sending it to the cloud, and it's in our. So I can pick up my phone and I can see where our machines are working right now, right this minute. I can see everything those machines are doing. I know more about those machines than the operator that's running. He has access to that stuff, but he's busy operating. So I can actually look at the transmission oil temperatures. I can look at differential. I can look at main gearboxes on that combine and see what
exactly is happening.
What the temperature is.
Dave, you're blowing my mind here. And here's why. Because you think over the years farming is such an and this is not a bad term, but it's such an archaic kind of ground up thing, right? Yeah. Like I lived in southern Minnesota for years. Southern Minnesota is known for farming.
Yes.
Yeah. Southern Minnesota is farmland, but technology really wasn't part of it. No. So how did you, I think that's a big question I have for you is, how did you learn the technology and how many years did it take for you? Because obviously your father maybe didn't use the technology that you use.
Yeah.
So where did that come into all of this?
It's kind of like, how'd you learn to use your cell phone, I guess.
Yeah.
You know,
Just played with it, right?
Yeah, and then, you know, you get a new cell phone and it doesn't act like the old one did, you know, and you get mad. You're like, I wish I had the old one back. And then you go, wow, this does so much more. It's been the same thing. So, you know, early, like I said, we were early adapters. So in the 90s when these monitors started coming out, you know, you just grow with it. You know, it's all of a sudden you're like, well, now you need 1.2, now you need 1.4, now we're up at, you know, 20.9, whatever.
Wow.
You know, so it's been a progression. So I think the mind-blowing part is for people like you or someone that would be new to, you know, would get into one of our machines or would sit down at the computer with me and say, like, what are you doing? It would blow your mind.
Yeah.
But I grew with it.
Yeah.
And then most growers that are progressive have done the same thing.
Yeah.
So it's interesting because I find myself, I'll be 69 in 2 weeks.
Nice.
And I think my computer literacy has actually come from growing up with those farm apps that we used.
We need our parents to do
Well,
that.
my parents are my father especially is from a family that did pistachio farming for a lot of years.
Oh, cool.
And so obviously the landscape's a little different.
Yes.
The weather's a little different.
Yes.
You know, what you need to grow the crop is a little different.
Yes.
But they didn't really have that kind of technology, you know, growing up. And so it's interesting to hear like how that technology is helping. We actually were just talking about pesticides the other day.
We were. Yeah.
Because my father now has he's been living with Parkinson's for the last 10 years.
Uh-huh.
And there's a part of my family that believes that some of his Parkinson's may be due to some of the pesticides that he's been around for the last.
I would not. I would have no argument with that. I could see that being a possibility.
You know, for his entire life. And now they're saying, well, you should get screened because, you know, part of the genetic breakdown
It passes
down from generation to generation. But it's interesting to hear the technology side of it, and that you know, why is the reason they're saying? I mean, I know you've had a heart transplant.
Yes.
Yeah.
Is that the main reason they're saying that you shouldn't be around?
So they compromise your immune system
With the medications.
to you know, protect against organ rejection. Is your immune system that wants to get rid of that thing that's not common to your body. The DNA is different.
Yeah.
So they try to match best they can, you know, but there's that difference, and there will always be that rejection factor. So the only way to deal with that is to compromise the immune system. So
Interesting.
So tell us that, you know, we should just get into it. We're trying to dancing around.
yeah, it was one other thing I want to real quick say.
Yeah,
This is
yeah.
something I don't know how I feel about, but I would bring it up about farming.
Yeah.
So AI,
Yeah.
the buzzword for everyone, right?
Yeah.
We are using AI
Really?
currently already. Farming is actually one place people didn't realize it was actually being kind of beta tested or whatever.
Really?
Yeah.
How so?
It's yield predictability, weather predictability, to look into, you know, like if this happened on the 13th of May, what happens on the 4th of July, you know.
Really?
If that happened on the 4th of July, back to coupled with May 13th, what's going to happen on August 1st. So
Is it pretty good, or is it
well,
been...
it's in the infancy, but there's some tendencies that are really strong and showing up. So
Interesting.
Yeah, so I just thought I'd throw that in there before we leave the subject.
AI has been affecting medicine now for you know, a
5
decade,
years probably, yeah.
right? And so to think about farming and technology, I think you blew my mind today.
Yeah.
You know, I mean, we're really talking about next level
Yep.
stuff.
Yeah.
And it's such an integral part of our.
Maybe we do a panel at some point and bring people from different industries in and talk about AI.
I love it.
That might be interesting.
I mean, AI is just changing everything. How do you think it has changed? Maybe, Dave, for the positive, how do you think it's changed your business?
Well, I don't know that we can quantify it yet, but it does make sense because what made me think about that was when you said about your father and the pesticides. If we can predict what's coming or not coming, we can use less chemistries and only use them when we suspect something is coming.
Interesting.
And if you can get ahead of it, it's kind of like a vaccination.
Yeah.
If you can get ahead of it, you use a lot less harmful things than if you're trying to treat something.
Yeah, that's interesting.
So that's what made me think about it, and where it's a food safety thing, it's a farmer safety thing, it should be better. So that's where I think we're going to see the biggest advantages.
Interesting.
Well, share your heart story. I'm really interested in hearing.
And I just know little bits and pieces, so I'm hearing a lot of this for the first time too. But I know it's an incredible story about how you've said you had a heart transplant, but kind of walk us through what kind of got you to that point.
Yep.
When you had it, how you had it, and who did it, because I may know them. And then, 'cause you have it in Indianapolis.
Well, that was at Fort Wayne Lutheran, but my current doctors are all retired, but they are now at IU.
Yeah.
They all moved to IU because Fort Wayne closed down. But
So nice.
At about age 35, I just felt a little tiredness, but I had 100 employees, and we were moving excavation work and paving and everything all across northern Indiana, lower Michigan, a lot going on. And so I went to a friend of mine, Dr. Paul Howard, who's now retired, cardiologist right here in South Bend, and went and had an appointment with him, and he did a bunch of tests and everything, and he said, there's something a little bit wrong with your heart. He goes, I wouldn't worry too much about it. He said, it's coming across as a murmur right now. He said, I would just do an annual checkup, and let's just kind of keep an eye on it. Well, after about 5 years of me giving him his $100 every year, I was like, nothing's changed, nothing's wrong. I'm going to stop going, right? Age 40, I start back up farming. Things are fine, right? Once I knew that it was just a slight, it was nothing major, it kind of emotionally, I was just kind of overcame it, But so fast forward a little bit, 2005, I would have been 49 years old. Went to, I think that's right. You can do the math, born in 56. 2005, I was getting really weak. I could just tell something was really wrong. So went locally, Dr. Kulkarni. I don't know if you're Dr. Kulkarni or not. Went there. He was the doctor I ended up with. I went through 3 or 4 cardiologists, different, that's not us. It's this, you got to go to this guy, go to that guy, whatever. I ended up with Dr. Kulkarni and ended up with a pacemaker, a dual pacemaker, and a defibrillator in me because my heart muscle was weak, and they had diagnosed me with cardiomyopathy, which just heart disease, but they thought it came from a virus. So at some time I was either sick or had an abscessed tooth or something. Virus got in my heart, and
what was your ejection fraction? Do you remember at its lowest?
So when they found that I had a problem, I was in the 20s. Okay. Yeah. My lowest, I was down to 10.
10, wow.
And that was 4 years, from 2005 to 2009. I was treated with, drugs and the
AICD.
Yeah.
Mm-hmm. So just for the audience, the heart is supposed to contract at somewhere between 60 and 70%. So each beat, the heart squeezes out 60 to 70% of the blood that's in there. You're considered in heart failure if you're under 50%. Under 35% is severe heart failure, and they put an AICD in. So 10% is very, very low.
Yeah. So, like I said, when they really found what it was, I was in the 20s. I think, whatever, in the low 20s. And that is, one doctor will say 20, another say 27. They look at it. And so anyway, but March of 2009, we went on a family vacation in Florida, and went to Disney and all the attractions, went on the river and canoed and did all kinds of stuff. But every night I would just come back to the hotel, and I'd tell my wife, man, I'm just so weak. I'm so tired. I can't hardly do this. And she's like, well, just hang in there, At the end of March, you have an appointment with Dr. Kulkarni, and, he'll adjust your meds, adjust your device, whatever, and you'll be okay. I went in there at the end of March of 2009, and kind of the ritual was the regimen, whatever. You come in, you do some testing, and I'd already done blood work and everything, and they do a couple, EKGs, whatever, and then you go see the doctor, right? Yeah. So she puts me on the EKG machine, and she's like, let's do that again. So we did 3 of them.
Wow.
And she's like, okay. She said, just a minute, I'll be right back. So, well, there's usually other tests they do because they're going to interrogate your device, right? The ICD. So anyway, She comes back and she goes, actually, you're going to go see Dr. Kulkarni now. And I really was kind of oblivious, I guess.
Yeah.
I thought, well, he probably has a procedure or something he needs to get to, so he wants to see me, get me out of the way, and then they can finish the testing, whatever. I walked in there, and he didn't look at me. He looked at my wife, and he said, how's he doing? And she said, well, he sleeps a lot. He says he's really tired. And he looked at me, and he goes, what do you say, man? And I said, yeah, she's right. And he goes like, well, there won't be any more tests today. And I said, oh, what's wrong? And he said, nothing else we can do for you. He said, you have taken a real plunge in your heart numbers. And that's when I was around 10 on my EF. So I'm getting choked up a little bit.
Yeah, that's okay. No, absolutely.
He said to my wife, he said that, you need to make final plans. She said, what do you final plans for what? He's not going to be here long.
Wow.
And she said, what, like a couple of years? And he goes, no. A year? No. He said, we have months.
Wow.
And she goes, like, 10 months? He goes, maybe 3.
Shoo.
He said, I give him 3 months.
Wow.
So that's the book I wrote, 3 Months to Live.
Yeah.
So anyway, he said, we were kind of leaving and just, kind of in shock. And he goes, there's one more thing. He goes, I don't think that you'll live long enough to do this. But he goes, have you ever considered a heart transplant? Well, no, I hadn't considered anything because I didn't know it was that sick, And he said, here, I'm going to give you some stuff to read. And you
think about it. Yeah.
It's always worth a chance, So went home. We started reading up on heart transplant. Like, no, I ain't doing that because it's a struggle.
It's intense. Yeah,
it's a lot to go through. So we kind of decided that maybe we just wait and see what happens and rely on our faith and pray a little harder, pray a little more, whatever. And the more I read and realized, I had 3 teenage children.
Yeah.
My daughter was engaged. She was going to get married. And I thought, I really need to try and stay alive if I can. So I had kind of opened myself up to being, considering the heart transplant. My wife was dead set against it.
Really?
Yeah.
Huh.
So no pun intended.
And why?
I think the caretaker really takes the brunt of the pressure and the all the agony. I mean, you're laying in bed with tubes and wires and half drugged out of the world, and you don't really think about what all's going on around you, but your caretaker, your spouse, carries that burden.
Yeah.
So she read on that, and she might just think that, and she strong woman with a lot of faith, and she's believing for a miracle, right?
Right.
We're not going to have this. So anyway, long story short, about 3 days after my appointment with Dr. Kulkarni, I was driving down the road with my pickup truck, and I could take you to the spot where that phone rang. And I recognized the phone number as the clinic. And so I answered because I thought maybe they changed some medication or something, But it was Dr. Kulkarni calling me. Excuse me. And he said, this David? And I said, yes. And he goes, Dr. Kulkarni. And I said, oh, hey. He goes, have you thought any more about that heart transplant thing? And I said, I think I would consider it, but my wife don't want to name. He talked to me for 40 minutes while I drove home. And I got home and I said, Dr. Kulkarni, I just pulled in the driveway. I said, let me talk to her. And he said, would it be okay if I'd have someone call you tomorrow? And I said, sure, have them call. So the next day, I get a phone call from Fort Wayne Lutheran Transplant Center. And they said, hey, we heard that you might be wanting to talk about heart transplant. And I said, yeah, sure. I might as well drive down Fort Wayne.
Yeah.
Listen, right? So she said, okay, she said, call Dr. Kulkarni and tell him to go ahead and do the referral. I said, okay. So I called Dr. Kulkarni, and he said, I did something I'm not supposed to do. He said, they have your files. He said, you just go on down there. So I went on down, and took me about 30 days to go through all the testing. I mean, they test you for everything. Because if there's anything lying in the weeds, it will come out as soon as they compromise your immune system, So they said, do you want to, do this over the summer? Do you want to, it's like, heck no. I mean, if I'm going to live 3 months, I got to hurry up, So So we took 30 days, a month of April, basically, of 2009, and did all the tests. Came back that I was strong enough to do, which is amazing with an EF of 10.
Yeah.
You know, they don't take many of those people. But, you know, my other health issues were
good,
strong,
yeah.
so I was good. So yeah, at the end of, I think it was the 27th of April, they called me and said, hey, we've accepted you as a patient. So when would you like to come in the hospital and start all your therapy? And I said, well, we might as well get started on it.
Right now,
so,
yeah.
So I went in on a Thursday, and there's just certain perimeters and numbers they look for. And so on Saturday, they kept asking me if I was doing okay. And I said, yeah. And they said, well, you're really responding to the medications and everything, and you're doing well. Probably 5 to 7 days, we can send you home, and they put you on an IV at home and keep you ready, you know.
Yeah.
And so fast forward to
How long were you on the list?
technically a day and a half.
Wow.
So
Wait, excuse me. What?
Holy cow. Yeah.
You were on the list for a day and a half?
so-
Wow.
Did they know they had the heart before they...
Well, okay, just let me tell
Yeah,
the story
yeah,
quick.
okay, yeah.
As quickly as I can.
That's amazing,
So Saturday night, at midnight, my nurse come in and woke me up. She said, are you doing okay? You feeling good? And I said, I feel great, you know. And she said, I'm going to do something. She said, I'm calling the doctor. And I said, why are we calling the doctor? And she said, I got to get his permission. We're going to put you on a 1A. She said, you're ready for a heart. She said, we can put a heart in you now. She said, you're ready. And she said, it's a good weekend, you know, if it's prom time and stuff. And it's another sad statistic, but it's a good time to get a heart.
Yeah.
So, yeah. So midnight, 1 o'clock in the morning, officially Sunday morning, I went on the list. Then I was very hyper. I'm just a type A or A plus something. I don't know what I am, but anyway, I would take little white pills if I was in school today. But
There you
anyway, I was very, you know, anxious, and so I know that they kind of, you know, subdued me a little bit. Some juice put in my. There's probably a Dr. Brian in the background.
That's probably true. Yeah,
some happy juice. But anyway, I was. I do remember Sunday morning that a nurse came in and took my water. Just took my water glass. I had a water cup by my side, and I was like awake enough to know that happened, but not awake enough to say, "Hey, I'm thirsty. I want my drink," you know. And so, about I guess it was around 1:30 in the afternoon, Sunday afternoon. I was startling awake. I mean, I just, boom, I was wide awake. So I know that they had done something to do that. You know?
Right.
And I looked up and I was thirsty. And so there was a nurse standing in my doorway. And it wasn't my nurse. At that point, you have your own nurse.
Right.
So there was a different nurse standing in the doorway. And I said, and she goes, oh, you need something? And I go like, yeah, I'd like my drink. And she goes like, there won't be any water. And I said, well, why not? About that time, my nurse comes up behind her and she goes, we have a heart for you.
Wow.
And I'm like, oh, wow.
That's crazy.
You know, and I said, oh okay. And she says, where's your family? And I said, well, they all went to church. I said, they should be here. They were going to load the excursion full of people and come to see me today. Yeah. So she said, well, do you want to call and see where they're at? And I said, yeah. And she said, I'll tell you what, I'm going to call your wife. And she said, when your phone rings here, pick it up, and she'll be on there. I said, okay. So my phone rings, pick it up. And I said, hey, Di. I said, where are you guys at? Well, we're about 5 minutes from the hospital. And I said, okay, because they want you here because they found a heart for me.
Yeah.
What I didn't know, my wife accidentally had put it on speakerphone. She had my mom, she had my whole family. Everyone heard me say they've got a heart for me. So that's kind of cool later. But anyway, that just starts the process. So then I was actually transplanted at 6 o'clock on Monday morning. Yeah. But what's really neat about this story is that there was a young man that had his heart today, and he was in an automobile accident, and the only injury was on the side of his head. But they said if they would open that, you know, his brain would boil out. He was that, you know, injured. So, but that had happened a week before. It happened on a Friday night. This is now Sunday.
Yeah.
Okay.
Yeah.
The parents, he was an organ donor, but they wanted him on life support. And they knew, the dad will tell you, I mean, I talk to him all the time, that they knew that they were losing their son. but they just weren't quite ready
Yeah.
to let go.
Yeah.
But he said that Sunday morning he woke up and he said, now, Dave, I'm not a real religious man or nothing, but he goes, I was taking a shower and I heard God say, today's the day.
Yeah.
So now remember, if it would have happened any earlier, I would not have
You
got
would have
this
been on
heart.
it. Yeah,
you know?
exactly. Wow.
So he said he walked into the hospital and he said the doctor was in the hallway and he said this was every day. He'd go like, any decision?
Yeah.
The doctor asking the father, no. But he said that Sunday morning, he said, I saw him and I said, hey, doc. He goes, today's the day.
Yeah.
He said, we're going to pull the plug. And so
Wow.
all that had, so that's why legally, technically, I was only on that list for about
day and a half.
day
Yeah.
and a half.
Wow, that's crazy.
So.
So when they did it, just the heart, right? They didn't do the lungs as well.
Just heart.
Yeah. Wow.
So how long, Brian? Not just kind of a medical question
Yeah,
too.
sure.
Like when?
Months.
Yeah.
Usually.
No.
yeah,
Yes, I
yeah.
know
Oh, yeah,
for the
transplant
list,
list. Yeah,
right?
yeah.
I mean, that's being generous,
Yeah,
right?
yeah,
Months, and you
yeah.
hear kind of horror stories of how long it
It's like
takes.
20,000 people a
Yeah.
year
Right.
Yeah.
die in the U.S. waiting on
Waiting on them.
When they say like, hey, like we're pulling the plug,
Yeah.
and he's on life support or whatever, there's an accident, or how long do they have for that heart beating to get it over to the new transplant patient?
So we typically for hearts, it's a little bit different than lungs and or than kidneys and liver. Heart, we take it out in the operating room pretty soon after. Like we keep them keep the patient's heart beating even though they've passed. So
Within the body itself.
as they take it, and then they transplant it right away. I mean, it goes straight from basically, if not in the same hospital, they will take it directly to a helicopter or a plane and get it straight to that to the
Mine
other
was
place.
Evansville, Indiana.
Yeah.
So then I think
So it wasn't long.
No, yeah.
No, I think the max is maybe a couple hours.
Yeah, I think you get
max.
6 or 8. Yeah,
And they
yeah.
put it on ice.
Yep.
Okay.
Yeah, I think it's longer than it was even back
Yeah.
16 years ago.
Yeah, probably. Yeah.
Mhm.
And so you've had your new heart for 16 years.
Yes, 16 and a half.
So I want to ask you a question, and it has to do with faith. You know, they say that having faith is believing in something that you haven't seen yet.
Uh-huh.
Did it make your faith stronger by going through this process?
Well, it certainly didn't weaken it. I would, and now I've made the remark that I don't know how someone does it without having faith or being a believer, but the Bible does say every man is given a measure of faith, so I think how much you exercise that is how much more you get. For me, maybe I'm a weak person, but I do not really know without having a faith in God and knowing that someone's pulling for me. I don't think I personally could have done it. So.
Yeah. How was the recovery?
I did recover fast.
Yeah.
On the 7th day, I was home in my own bed.
Wow. Yeah.
Wow.
Did have a problem after that because, a lot of biopsies early on to check for rejection. And they punched a hole in my heart wall and did not know it in the biopsy. And I ended up spending 30 days in the hospital.
Wow.
It was actually harder than the transplant.
Really?
Yeah, because I took on a lot of fluid.
Yeah.
And that almost cost me.
Yeah.
So, but then if that little, and I'll be the last to judge those doctors, from anybody can make a mistake. It was just a small error,
Yeah.
but that's how you would know, you'd understand how, touchy that situation.
Oh, yeah.
To shove a camera and the scissors up somebody's
And take a
groin and
tiny
take a
little,
little, it's just such a micro environment that I cannot imagine, but I know because I've watched a heart cath and stuff. I can imagine, but I don't really have a feel for how tight that tolerance is,
Mm-hmm.
So for them to punch a hole in my heart wall, I just say it to say that it did put me back in the hospital for 30 days, but other than that, I never had to do physical rehab.
Really?
Yeah. I
Just
come
pop
out
right
of there
back, huh?
swinging,
Look
you
at
know.
that. It's probably all the farming, right? I mean, people on a farm.
I think it's more of a personality thing.
that's true.
You know, I think you know, some of us refuse to go down, you know, so I'm one of those. I'm not bragging. It's just my makeup.
Just who you are, yeah. So you're one of the longest surviving transplant patients, right?
Yeah, well, you know, as time goes on, you know, the average lifespan is longer than it used to be. But yes, there's mileposts that, you know, they know that if you make it 5 years, you're probably gonna make it 7. So between 7 and 10, they get real nervous, and I just finally ask them, you know, because I want to know, right?
Yeah.
If I'm gonna try, you know, you're making me do things that we didn't have to do before. I want to know why,
yeah.
you know, and they're like, well, we lose most of our patients between 7 and 10
the chronic
years.
rejection phase.
Yes.
Yeah.
Mm-hmm. So there's those things. Right now, I'm to the point where it's like, hey,
Kind of
how
out
you
of the
doing?
woods.
You know?
Yeah, right. Yeah, you're kind of out of the
So,
woods at this point. Yeah, it's
yeah.
more part of you now. Yeah.
Mm-hmm.
Interesting. Well, that's cool. That's an awesome story.
I do want to ask one more thing
sure.
as related to that. What do you think you've learned over the last 16 and a half years? You know, what is the biggest thing you've learned?
Patience, probably, which is far from a natural attribute of mine. But just, you know, I used to be the guy that, like, if the doctor was 5 minutes late, I'd be like PO'd pretty good, you know, and my time's valuable too.
I'm laughing because it sounds familiar to myself.
same.
You know,
Exactly.
like it sounds.
But, you know, I remember one time I was laying in the hospital there just for a checkup, and they were going to do a biopsy on me, heart cath biopsy. And I'm laying there, and I'm all prepped. I'm ready to go in. The guy put the medicine in me and everything, you know. And they come out, and they go like, going to have to push you back on the hallway. And I go, something wrong? Not with you, but we have an emergency.
Yeah.
And, you know, I laid there for 3-4 hours on a stainless steel table, waiting. And I had to learn that, you know, that emergency was much more important than my little procedure I had to have that day. So I learned to wait my turn. I learned to be patient. That's probably the biggest thing that I've learned. And also learned to follow instructions. I have been very faithful in doing what they ask me to do. And normally I'm the kind of guy that rips everything out, throws it on the floor, and try to find the screw that fits the hole. You know, but I learned that with this was my life. If I'm going to do this and I'm going to be successful at it, I need to listen and I need to learn. So I've educated myself, and I've learned that, you know, the doctors, the whole staff, they're just people too, you know, and I've often very high regards for any doctor that would take a living person and take an organ out of them and try to put a better organ into them. That is a leap of faith in itself.
Who was your doc?
So I started out with 4 doctors, and Dr. Ledowski was actually the head at Lutheran at the time. So then he had a personal accident, but did miraculously come back to work. So went to IU Hospital is where all that staff is now. They've all retired. The doctors have all retired.
How long is that surgery? How long is the heart transplant?
6-8 hours, 10 hours, depending on.
I was in there about 6 hours.
Yeah,
so.
depending on how much. And if you do heart lung together, which sometimes they do, it's even longer.
What about the anesthesia? What is different about that procedure? Maybe the transplants that, you know, than a normal right surgery.
So that's probably the most complex anesthetic that we do, because it's initially it's kind of a regular anesthetic, and then you have to do what you would do for an open heart, which is bypass and all that sort of stuff, and then you circ arrest, which means you stop everything, right? So even when you're on bypass, there's still blood circulating. Typically for a lung a heart transplant, you do a circulatory arrest where there's nothing moving at all. And then you implant it. And so now it's not just a heart surgery, it's also a transplant surgery, which has all kinds of other kind of complications. So the anesthetic for that is very complex. I mean, that's probably the most complex surgery that we do.
That there is.
Mm-hmm. Yeah.
Interesting.
So. Yeah, because, you know, they didn't wake me up till, you know, so I went in there at 4:00 in the morning on a Monday morning. I did not wake up till
Wednesday.
Mid-afternoon. No, Wednesday. It was probably mid-afternoon.
Do you remember the
late
date?
Afternoon. I remember it very well because they give you very specific instructions, and then, you know, they're right there because they know the second you're going to wake up, you know, and they're talking in your ear. Remember what we told you, you know. And the first thing, your instinct is to rip everything off or to try and, you know, gasp for air, and they're like, "Don't breathe, just relax," you know. And so I remember waking up. I'm like, "Oh, I made it," you know. I didn't die on the table, and I'm going. Then my mind instantly went to those because they're saying this to you.
Yeah,
remember
what we said.
Remember what we said. You know, don't do this, don't do that. And I'm like, remember them saying. I hear them saying it. So it's really. I'll never forget that moment of waking up as long as I live.
Did they take the tube out when you woke up?
No.
It was already out, or you kept it in for a couple days?
It was left in. Yeah.
Interesting. Yeah. So that was deep.
Yeah.
I do now want to go on to something that's more sort of fanciful, which is your social media. So tell us, first of all, tell us what your handle is. Tell us what you do, and then how you got into it.
So it's Schrock Dave on TikTok, but you can go on my Facebook, and I will friend you if you ask. It's just Dave Schrock.
I'm gonna have to do that now that you said I'm gonna. You're gonna friend me.
So, of course, my Instagram is tied to my Dave Schrock too. So, I'm a part of Total Acre. Total Acre is a peer group of 700 growers across the United States and Canada, and we share our cropping data information. So I've helped farmers through that, and then I'm part of a site called Farm Life. It's also on all those platforms. Also have a Facebook site called Crop Mythbusters.
Okay.
So there's just a lot of misinformation, probably like what the reason you do
with
what
medicine.
you do.
Yeah, exactly.
You know, it's like it's in every industry, right?
Yeah.
And everyone has these assumptions, right? Everyone's a professional since Dr. Google came around. So anyway,
And ChatGPT.
AI now.
Yeah, AI. So I just over the years, back to my heart transplant. I had a little bit of a come to Jesus, you could say. I had learned a lot of things about farming because I was analytical and I like to dig into stuff. And so I had learned that there's just little things that make crop farming better, right? Well, I realized that I almost died and that information would have died with me.
Yeah.
And so I felt a need to share that with young growers or even older growers that want to learn, whoever has an ear. In that whole 16 years since then, social media has exploded, right? So everyone's a professional now.
Right.
Everyone who can grab a mic, can grab a phone, whatever, do a podcast, whatever, is a professional farmer. And there's just so much misinformation out there. So I'm always trying to, better that. So I just thought another avenue of doing that is just do silly videos, right? Satire. Show people how, we really don't think through things. We just hear that, this
you guys are very similar.
We are, that's right.
Yeah. So, I'm like, okay, well, I'm just going to show you how dumb we really are, you know? And it's people call me up all the time, man, we really don't think much, do we? We just listen, right? And I said, yeah. And so, I get a lot of phone calls. So, on my Facebook site, I do just the satire thing. I pick up a little... like people say, like, well, you got to do this to your crops. And so I'll say, here's what we did, we didn't do anything.
And the wigs. I love the wigs, too.
Yeah. So that's, I have a long-haired wig I wear, so.
Do you guys you live on a farm?
Oh, yeah, we farm actively,
And you have animals there? Or
no animals.
No animals, but because of your heart. But corn,
soybeans, wheat.
So do you think we should bring Brian down and we can do some informative, funny content on the farm?
Yeah,
we should.
Sure.
Yeah, definitely.
I was thinking about this. I'm like, this is a great opportunity to get you back on the farm.
Back on the farm.
Back on the farm. Yeah.
I mean, you didn't grow up too far from farmland.
No, I wasn't far from a farm, but I was in no way, shape, or form a farmer.
Not a farmer.
No.
He was way
You consider yourself a city guy?
Suburban
guy.
Yeah.
But growing up, Zionsville.
Suburban.
Yeah, okay. But Indy wasn't as big.
No. And I lived right, there was one house between me and then a farm that was probably, I don't know, probably small for you, but 70, 80 acres.
Yeah.
So, we used to run through the corn.
Yeah.
Well, how about this? We will bring the camera down there.
Let's do it.
Let's do
and
it.
we will do some cross-content videos
I love it.
Sure.
on the farm.
And where can we find your book?
So my book, you're going to have to contact me personally because I did not want to sell the book.
All right.
Okay. I wanted to be a blessing to people and give it. So you can email me, schrockfarms@yahoo.com. That's easy. SCHROCK farms@yahoo.com. I'll send you one. We do have them on the bookshelf at Influence Church in Granger. And there you have to pay a little something because I donated them to the church, but it's cheap. So,
Okay.
Yeah. So we'll get you one. You just got to get hold of me.
Awesome.
Tell Brian, and Brian will get a hold of me.
Yeah, there we go. Yeah. Put a comment in the
Put an
the
address
comments.
in the comments, and we'll get you booked.
Well, I will say this is a treat to have you on, and a blessing to be able to talk about this with you.
Yeah.
I actually did one story. I'm a journalist.
Yes.
If Brian got you up to date on that, and I did one story years ago about a young gentleman who is from Pennsylvania originally, and he was very young at the time. I think he was 14 or 15.
Okay.
And a young woman from Elkhart, Indiana, passed away because of a tragic accident, and he got her heart.
Awesome.
And I did the story on the 5-year anniversary.
Okay.
Because they remember her every year.
Sure.
nice.
Yep.
And now he's 20. I believe he's 24. He has a child.
Wow.
Okay.
And he's a firefighter actually, but he has a
Awesome.
second heart. So his first heart
Rejected.
after about 5 or 6. It was longer than that. It was about
Probably in the
7 or
10
8 years,
Okay.
right when you're saying.
Yeah.
Okay.
And he received a new heart, but he is, knock on wood, he's doing okay.
Good.
And so it just reminded me of that story, and knowing
That's
that there's a connection between the family
Yeah.
Yeah.
and the recipient.
Yeah.
And
I have a very good relationship with my donor family now. So I've been in their home half a dozen times and feel like we're family. Talk to them quite often. So
I was a young journalist when I told that story, but it's still one of my all-time favorite stories to tell because, it's real.
Yeah.
And so I appreciate you coming on the podcast, and Brian O'Brien appreciate it.
Absolutely.
Oh, thank you. It's an honor to be here. I really
great.
appreciate being allowed to be here.
Absolutely, yeah.
Hey.
It's awesome. Yeah. We're usually a little funnier. I think today was a nice change to have the
Brian
have
thinks
a deep,
he's funny.
well,
have a deep conversation.
Brian-
I'm hilarious, all right?
Because I can do funny.
I
too.
know you can. I know you can. I
I'm
know
really
you can.
looking forward to this cross-content
That will be-
situation here.
We'll do the funny there. We'll do the funny there. So
All right. Well, David Schrock, thank you so much for being on the podcast. For
Thank
Brian
you.
Schmutzler, I'm Vahid Sadrzadeh, and this has been Going Under Anesthesia Answered, brought to you by
the Butterfly Network.
Butterfly Network. We'll see you in the next one.